sustainability and green energy, Viking heritage, welfare system, new Nordic food. Welcome to Denmark Explained, where we explore the rich tapestry of Danish culture, one captivating story at a time. Denmark is often hailed as a country with one of the best healthcare systems in the world. For expats, this might be reassuring at first glance. After all, who wouldn't want to live in a country where universal healthcare is the norm? However, as many expats soon learn, the reality of accessing the Danish healthcare system is far more complex and challenging than it might appear on paper. Beneath the glossy surface of a universal system lies a web of bureaucratic red tape, unfamiliar rules, and an often daunting process that many expats struggle to navigate. But before we continue, please support the channel by pressing the like button, share, and hit subscribe. Thank you. One of the first things any expat learns when they move to Denmark is the importance of registering with the Danish Civil Registration System, or CPR. This registration is crucial for accessing a wide range of public services, including healthcare. Without it, expats are essentially shut out of the system. The process can take several weeks or even months, and during this time, new arrivals might find themselves without access to a doctor or hospital, despite paying into the system via taxes or insurance. Once the CPR number is secured, it doesn't automatically mean seamless access to healthcare. Unlike other countries where expats can easily buy into a public system, the Danish healthcare system requires that you become a part of the local municipality or commune. While this sounds straightforward, many expats find themselves dealing with delayed paperwork, communication barriers, and a lack of understanding about their rights as temporary or permanent residents. There is also the requirement for expats to have valid health insurance. In some cases, even once a CPR number has been obtained, you may not be immediately eligible for full coverage under the public healthcare system unless you are employed or meet specific residency requirements. This creates a frustrating scenario for newcomers who may need medical attention in the first few months, but find themselves unable to access the services they need due to the strict waiting period and unclear regulations. The uncertainty and lack of transparency regarding how long it will take to gain full access to healthcare can be both stressful and discouraging. Even after you've managed to navigate the registration process, you may face long waiting times to actually see a general practitioner or GP. The Danish healthcare system heavily relies on primary care, meaning your GP is your first point of contact for nearly every health issue. But with a shortage of doctors and a large population relying on the same pool of healthcare professionals, getting an appointment often means waiting weeks. This can be particularly frustrating for expats unfamiliar with the system, who may come from countries where seeing a doctor is a relatively quick and simple process. In Denmark, however, it's not uncommon for people to wait for days or even weeks just to get an appointment for a non-emergency consultation. For expats, this delay can feel like an endless game of bureaucracy. While they are already navigating new life in a foreign country, they must also deal with a healthcare system that often seems more intent on making things difficult than providing immediate care. The waiting period isn't limited to GPs. It extends to a variety of healthcare services. Whether it's getting a specialist referral, receiving a routine medical procedure, or accessing mental health support, long wait times are a recurring theme in the Danish healthcare experience. Expats may be surprised to find themselves waiting for months for a simple appointment, which could have been dealt with in a matter of days back home. This is especially true for those with chronic conditions or complex health needs, who often require continuous care or regular appointments. In addition to waiting times, the healthcare system's focus on general practitioners as the first line of care can also create frustration. In many other countries, access to specialists is more streamlined and requires less bureaucratic navigation. However, in Denmark, you can't just go directly to a specialist for an issue that may require one. You must first see a GP who may then refer you, creating another layer of delay. One of the most significant challenges that expats face in the Danish healthcare system is the language barrier. While many Danes speak excellent English, medical consultations are not always conducted in English. As a result, expats often find themselves in situations where they are unable to fully understand their medical conditions or the prescribed treatment. This can create a sense of frustration and confusion, especially when it comes to dealing with anything more complex than a routine checkup. In emergencies, this problem can become even more acute. Miscommunication can lead to misdiagnosis, delayed treatments, or even unnecessary tests. The reliance on Danish-speaking staff and the lack of bilingual resources in some areas make it a particularly challenging system for expats who may already be overwhelmed by their new life in Denmark. Even with English-speaking doctors, medical terminology can often be too technical or nuanced for expats to comprehend fully, leading to doubts about the diagnosis or treatment plan. Some regions in Denmark have begun offering medical services in English, especially in areas with high numbers of expats. However, these services are often limited to larger cities like Copenhagen and Aarhus, leaving smaller towns and rural areas with few options for those who don't speak Danish fluently. For those living in less urban areas, finding a bilingual doctor or specialist can be a significant hurdle. The frustration doesn't end with doctor-patient communication. For many expats, understanding the complexities of the Danish healthcare system itself, such as billing, prescriptions, and patient rights, can be a daunting task. If you need to inquire about your treatment or billing details, you may find that the person you are speaking to either doesn't speak English or cannot explain the issue clearly, making what should be a straightforward process feel impossible to navigate. When it comes to emergency care, expats may believe that they are fully covered under the universal healthcare system. And while Denmark does offer emergency services to all residents, the practicalities of accessing those services can still be complicated for newcomers. If you need to visit the emergency room, it's not as simple as just walking in. You may be required to pay a co-payment for certain services, and the process can be long and time-consuming. In addition, the number of emergency rooms in Denmark is limited, and some areas are far removed from large medical centers, leaving expats feeling stranded in case of an emergency. Denmark's emergency services are highly effective but also highly specialized. This means that if you're in a less populated area, you may not have direct access to the same level of immediate care as you would in a larger city. Rural areas often rely on local clinics or smaller hospitals, which might not have the resources to handle emergencies as effectively as larger institutions. Consequently, expats living in such areas may feel vulnerable when it comes to emergency situations, knowing that the nearest hospital may be hours away. Another issue is that the Danish emergency system is largely integrated into the larger public healthcare system, meaning that it is often difficult for expats to access immediate private emergency care without paying significant out-of-pocket costs. Private healthcare providers in Denmark are less likely to offer emergency care services, and many expats find that they are often stuck waiting for hours in emergency rooms before being seen. While Denmark's healthcare system is excellent for general care, it is notorious for long waits for specialized treatments and surgeries. For expats who require more specialized attention, the wait times can feel interminable. From dermatology to orthopedics, the backlog for specialists is long, and many expats find themselves wondering if their health concerns will be addressed before they deteriorate further. The problem is compounded by the fact that many medical fields in Denmark suffer from understaffing or resource limitations. There are simply not enough doctors or specialists to meet the growing demand, leading to extensive wait lists. Many expats, especially those with complex or long-term medical conditions, can find themselves waiting for months before they can see a specialist or receive necessary surgery. Additionally, the referral system adds an additional layer of delay. To see a specialist, you first need a referral from a GP. However, given the pressure on general practitioners, getting this referral is not always straightforward. Even after the referral is made, the wait to see a specialist can range from several weeks to months, leaving expats in limbo while their health issues persist. Many expats report that they feel like they're caught in an endless loop of waiting for medical attention, which can be a source of stress and anxiety. For many expats, private health insurance becomes a necessary supplement to the Danish public healthcare system. The problem, however, is the high cost of these plans. While the public system covers a significant portion of healthcare expenses, it doesn't cover everything. Expats often find themselves facing substantial out-of-pocket costs for certain services, particularly for those not covered under the public insurance system. Private insurance can help alleviate these costs. but it often comes with hefty premiums and policies that can be difficult to navigate. Moreover, some private insurers may have limited networks or specific exclusions, leaving expats with the difficult decision of whether to pay for additional coverage or take their chances with the public system. Some expats may opt to buy international health insurance to avoid dealing with the complications of the Danish system. However, international policies often have much higher premiums, and the coverage may not always align with Denmark's healthcare system. For example, some international health insurance policies don't cover certain types of treatment, or may require an upfront payment before reimbursement, adding another layer of stress for expats who are already navigating the complexities of healthcare in a new country. In theory, Denmark's healthcare system is built to be universal, accessible, and effective. In practice, however, it often fails to meet the needs of expats. From bureaucratic hurdles to long waits, language barriers, and high insurance costs, the Danish healthcare system can be a difficult terrain to navigate for newcomers. While many expats eventually find their footing, the road to proper healthcare is often filled with frustration, confusion, and uncertainty. For expats moving to Denmark, it's essential to be prepared for a system that doesn't always operate in the straightforward, efficient manner they might expect from a world-class healthcare provider. The challenges faced by newcomers can often feel discouraging, but there are ways to manage and cope with the system. While some expats may ultimately choose to rely on private health insurance or go through the lengthy process of getting accustomed to the public system, it's clear that the Danish healthcare system, though highly regarded, does not always provide an ideal experience for foreign residents. Still, with patience, persistence, and the right support, expats can eventually navigate the complexities and find ways to access the care they need. What would be your approach when it comes to healthcare in a foreign country like Denmark? Would you take the time to learn the system thoroughly, despite its challenges, to ensure you understand the ins and outs of healthcare access? Or would you seek to bypass the public system entirely by relying more on private health insurance, even if it means paying higher premiums and navigating complex policies? We hope you enjoyed this video. Feel free to share your thoughts in the comments below. Don't forget to like, share, and subscribe. It really helps us bring you more amazing content. Join us here at Denmark Explained, where we uncover the wonders of Danish culture one story at a time. See you in the next video.